Okay, so constipation is a symptom that affects many people with Parkinson's and can have a huge impact on the quality of life. So please note the information that's provided today is general in nature only, and it might be different from what the advice is provided by your neurologist or your GP. So please follow that advice that you've been given and discuss management of your individual symptoms with your healthcare practitioner. So today's discussion will cover a bit about the background. We'll have a look at what is regular. We will talk about causes and contributing factors, how we can manage constipation by lifestyle managements, then the use of laxatives when appropriate, who you can ask for help, and then at the end, we'll answer questions. So you may have heard in the news recently a lot of research which has been conducted by Professor Richard Gordon and the Queensland University of Technology involving the gut microbiome. So studies have identified for people with Parkinson's, there can be higher numbers of certain strains of bacteria and less of others. So research about restoring the balance of gut flora is being investigated, and it'll be interesting to see the results and outcomes of that. So our gut microbial ecosystem, it's a collection of trillions of microorganisms living inside our gut, which consists of bacteria, viruses, fungi and yeasts, and other organisms that have yet to be identified. 99% of these bacteria are protective and around 1% is pathogenic, meaning it can be disease causing. So the good microbes produce metabolites which contribute to maintaining the mucosal barrier, which is protective. It assists our immunity and reduces inflammation in our body. This is just a slide that shows the different stages of Parkinson's and typically when symptoms may appear. Not everyone will develop all symptoms and they can occur at different times. Just on the left here, though, you can see that constipation along with REM sleep behavior disorder can occur very early and it can proceed decades prior to a Parkinson's diagnosis. So what does regular mean? So some people, normal means having a bowel motion 3 times a day. And for others, it can mean only going 3 times per week. So normal or regular can be anywhere in between that. Stools should be soft and easy to pass, and there should be no straining. If you live with a chronic condition, it might mean that changes progress slowly over time. So you can get used to feeling what a new normal is. And you might only notice issues if symptoms are particularly bothersome. So it's important to be aware of your bowel motions so that you can stay on top of it rather than treating constipation after it becomes a problem. So the message is stay on top of the curve. This is the Bristol stool chart, which some of you may have seen before. So your feces are a result of what you eat, your fluid intake, medications, other health conditions, and lifestyle. And the appearance of your stool is affected by the transit time in your colon. So at the top of the chart, type 1 and type 2 indicate constipation. So feces have remained for a longer time in the large intestine where water is absorbed back into the body. They're separate, they could be hard lumps, and they're difficult to pass. So type 3 and 4 in the middle here, they appear soft, snake and sausage-like. So that's the ideal, what we're aiming for. And then at the bottom of the page, type 6 or 7, This occurs when there is a short transit time and the appearance is watery, mushy, unformed, and indicate diarrhea and urgency. So the gut is regulated by the enteric nervous system, which controls motility, secretion, and absorption. In Parkinson's, there's a loss of dopamine producing cells in both the brain and the gut. And this is due to a protein, alpha synuclein, which misfolds and aggregates. And as a result, bile muscles can become slow, rigid, and weak, resulting in uncoordinated contractions. There can also be clenching of the anal sphincter. So instead of relaxing when you're trying to pass a motion, it contracts. Reduced mobility can decrease physical activity, which in turn can slow digestion and gut motility. There can be dietary changes due to difficulty swallowing and chewing food, and this plays a part. And there can be changes in saliva production. It can be insufficient or thick. Anxiety and stress can also contribute, and constipation can also be a side effect of Parkinson's medication or other medications or supplements. For example, iron supplements, pain medication, which may contain opioids, or even taking things such as antacids or reflux medication. So severe constipation has a large impact on quality of life, and sometimes you might not link some of these symptoms to constipation. So it can make you feel unwell, tired, nauseous, and have headaches. You might have reduced appetite. There can be abdominal pain, reflux, and bloating. There may be weight gain or weight loss. And your body's not able to absorb medication as well, so your Parkinson's symptoms can worsen. It can increase bladder frequency and irritation by pressing against the bladder. Now, bowel impaction is very serious. There can be accidental leakage or overflow, so don't confuse this with watery stools or diarrhea. It requires urgent medical attention. So where we had a look at the bowel chart with type 6 or 7 previously, just make sure you're not thinking it's diarrhea. You might just be having accidental leakage, so it's not a full bowel motion. And severe constipation can also lead to psychological and social distress, and it can be a deterrent from you going out and enjoying social events. So sometimes it's hard to remember or to keep tab of your bowel motions. So a bowel diary is helpful. So you can download this from the Continence Foundation of Australia website, or we're able to email this to you. So basically keeping a diary means recording your bowel motions for 1 week to see if a pattern emerges, and you can use it to self-monitor to find out what works best for you, or you can provide this to your GP or continence nurse for further advice. Okay, so how do we manage constipation? So lifestyle and dietary changes are key, and we should always try to look at these first. So incorporating exercise and movement in your daily routine is very important. Aim for a minimum of 30 minutes per day. The more you can do, the better. So you need to manage this around fatigue and timing of your medication. Everyone has different capabilities, so work with a physiotherapist to increase your mobility, or an exercise physiologist can write a tailored exercise program that is suitable for you. Exercise should feel challenging, and pelvic floor exercises for both men and women may also be of benefit. And engaging a physio with experience in neurological conditions is recommended, and you can contact us here at the InfoLine if you need guidance on where to locate one. Increasing dietary fibre to 30 grams per day helps to bulk up your stool. So aim for 2 serves of whole fruit, 5 serves of vegetables such as peas, beans, lentils, and 3 to 6 serves of whole grains, which include nuts and seeds. There's no specific diet recommended for Parkinson's, but a Mediterranean diet may be suitable to follow. There is a video on our website from a dietitian discussing nutrition. It's called Living Well with Right Nutrition, and you can also access that from our YouTube channel. So some Parkinson's medication can trigger binge eating or craving sugary foods. Try substituting that with fruit. Treats on top of a good diet is fine, but not if you are replacing them for meals. And you can consult a dietitian for individual advice, especially if you have reduced appetite or experiencing weight loss. If you have issues with swallowing or changes to saliva production, a speech pathologist can assist with management and recommending suitable food and liquid consistencies. A common symptom of Parkinson is bladder frequency, and this can deter people from drinking sufficient water. So we want to aim for about 1.5 to 2 litres per day. And a good way to monitor your intake is to purchase a 600 ml bottle, fill that up, and then we're refilling this 2 more times per day. So sip this throughout the day and limit fluid intake 2 hours prior to bedtime, so your sleep's not disturbed with having to get up too much during the night. Constipation can contribute to bladder frequency by placing pressure on the bladder, and it can cause a feeling of frequency. It may also inhibit the bladder from emptying completely, which can lead to urinary tract infections. So try to limit caffeine, alcohol, and sugary drinks to prevent bladder irritation. Also be mindful you can lose water through other body processes such as excessive saliva production. So we all produce about 1.5 litres per day in saliva. So if you have reduced swallowing and you're not swallowing that back into the body, that's a lot of liquid to lose. Some people might also have excessive sweating, or if you're running air conditioning to heat rooms in winter or cool during summer, you can lose a lot of moisture through the skin. So we definitely need to replace fluids by drinking. We also want to establish good regular toileting routines. So do not resist the urge to go. And toileting position may help. So just in this diagram down the bottom, the correct position is to lean forward, resting your elbows on your knees, and perhaps supporting your feet with a footstool to elevate your legs may help. And you can consult an occupational therapist for suitable equipment such as toilet frames for your individual needs. Anxiety and stress can also have an impact on your bowels, and it's often linked to irritable bowel syndrome, where you can alternate between constipation and diarrhea. So finding ways to manage stress, such as meditation, yoga, Tai Chi, is helpful. And we also have counsellors available at Parkinson's New South Wales if you need support in this area. So laxatives may sometimes be used if you're not yielding results from any of your lifestyle managements, and they will soften feces or increase bowel activities. You can consult with a pharmacist who knows your medical history to recommend what may be suitable for you to try. And some people with Parkinson's may need to take laxatives on an ongoing basis, and you might need to take a combination of different types of laxatives. But please be mindful, don't go the other way, don't go overboard. Take too much laxatives. If they're producing diarrhea or watery stools, you do need to reduce or cease them for some short amounts of time. So I'll just run through quickly. I don't want to spend too much time on the different types, but bulking agents, these might be your psyllium husks or Benifiber. Start slowly to ensure you don't have bloating, wind, or flatulence, which can occur initially when you're first taking them. And you need to make sure you're drinking plenty of liquid with these. And they also act as a good prebiotic. Softeners, these include docusate, which is Caloxyl. These draw water and fats back into the stool so they're easier to pass. We then have osmotic laxatives such as your macrogol, lactulose, and sorbitols. And these are not absorbed well from the gut. They work by attracting water back into the intestine, increasing your volume of the stool. Once again, we need to ensure there's adequate liquid intake, otherwise you can become dehydrated. And be mindful if you already have low blood pressure or low blood pressure from your Parkinson's medication. If you've been taking these for a long time, you may also need to take an electrolyte fluid replacement such as hydrolyte. Stimulants are senna or bisacodyl, and these stimulate the nerves in the gut so muscles contract more. Ideally, start with your other types of laxatives first, and you can add this as an add-on or intermittent use. In some cases, you may need to take these regularly. They can cause some cramping. And then there's also suppositories that you can use. These work a little bit faster, anywhere between 15 to 60 minutes. They mostly work to evacuate the lower bowel. Just having a look at prebiotics versus probiotics. So probiotics are live bacteria that occur in our gut, and the prebiotics are the food which the probiotics live off. So these are found in high fiber foods that we discussed before, fruits and vegetables, legumes, nuts and seeds. So dietary probiotics occur naturally in foods, and they can also be added to some dietary supplements. So you might find them in yogurt, kefir, sauerkraut, miso, pickles, and kombucha. And there was a study done in 2020 by ATAN looking at the use of multistrain probiotics in the management of constipation. So if you look at the chart after 1 or 2 weeks use, so that's taking it daily, there wasn't too much difference, but around the 3 to 4 week mark, there was an increase in spontaneous bowel movements. So these are available from your chemist, and just getting a broad spectrum multistrain is beneficial. If you look on the bottle, some may only contain 1 to 2 strains, but there are others that will contain perhaps 12 to 15 different strains. So just have a discussion with your neurologist or a dietitian, your GP or pharmacist to see if this is going to be suitable for yourself. Bloating and gas can occur in the first week as your gut microbiota changes. Botox injections can sometimes be used to relax anal sphincter, an overactive bladder, or excessive drooling for salivary glands. This is probably really used if your symptoms are very severe and you just need to discuss that with the neurologist. So who can you ask for help? Obviously, you need to speak with your neurologist and your GP, and you should have a whole team of allied health to support you. So always tell your neurologist of any Parkinson's symptoms you have. If they don't know about it, they can't help you manage them. So write notes as you go along and take this list to your appointments. Most people only see their neurologist every 6 months, so make sure you discuss everything you need to when you are there. A physio or exercise physiologist can work with you to maintain mobility and movements and recommend pelvic floor exercises. Seeing a dietitian, they can recommend changes in your food and fluid intake. A speech pathologist is not only for communication, but they can help maintain the swallowing reflex. They can help management of symptoms due to changes with saliva production and can advise changes to food consistency. Speak to your local pharmacist. Try to go to the same pharmacy so they have a history of your medicines and your they can also review all your medications, your use of laxatives and vitamins or supplements. An occupational therapist can recommend appropriate toilet aids for you and positioning. And if you haven't visited, Continence Foundation of Australia have a website and a helpline, which is manned by nurses. So you can consult them for assistance. And for some people that need continence pads, you can apply for the Continence AIDS Payment Scheme. So for the 2024-25 year, I think the rebate's about $694. So it's not a lot, but every little bit helps. And if you do find that you're not going out and about because of bladder frequency or issues with bowels, there is a toilet map that you can use, which you can find public toilets. And of course, you can always chat with us on the InfoLine.